Hundreds of people are at risk of contracting coronavirus after a doctor in northeast Delhi's Mohalla clinic tested positive for COVID-19 on Wednesday. The doctor got infected after coming in touch with a COVID-19 patient who had returned from Saudi Arabia. A total of 8 people, including the doctor's wife, his daughter, have tested positive. Meanwhile, 900 people who might have primarily or secondarily come in contact with the doctor have been identified and have been kept in isolation. The number of active COVID-19 cases in the national capital have now gone up to 36.
अभी वो हॉस्पिटल में एडमिटेड है, आईसीयू में थे कल तक और कल आईसीयू से बाहर आ गए हैं, अब स्टेबल है बिल्कुल ठीक है। और डॉक्टर गोपाल झा के कॉन्टैक्ट से 2 लोगों को, उनकी वाइफ और बेटी दोनों पॉजिटिव पाए गए हैं, दोनों को एडमिट किया गया है। जो उस दिन से लेकर 12 तारीख से लेकर जब तक उन्होंने ड्यूटी पे रहे हैं, 4 दिन ड्यूटी पे रहे हों, तो 4 या 5 दिन की ड्यूटी पे जितने सभी लोगों से कॉन्टैक्ट किया गया, लगभग 800 के करीब लोग हैं, उन सभी लोगों को 14 दिन के लिए होम क्वारंटाइन किया गया।
Going across to my colleague Munish Pandey, who is joining us with more details on this story. Munish, now this is the kind of spread that is going to worry not only the government of Delhi, but of course, the governments across the country. Doctors, those who are in the front line of this fight, if they come across a patient who has not disclosed his history, they do not know who they are treating, this becomes a very big problem. It could spread very, very fast.
Absolutely, Ankit, and the doctors, including the medical practitioners who are in the front line to fight coronavirus, even they are continuously exposed to this COVID-19. They are always on the duty, and in this case, it is very important to point out that the lady traveled from Saudi Arabia on 12th of March. She never disclosed that she has come from Saudi Arabia, and then she met this doctor. And now the entire family of the doctor, which includes 8 members of the family, they have been quarantined. Doctor has been tested positive for COVID-19, and now Delhi government maintains that at least 800 people have been asked to go into self-quarantine. So it has become very serious because the doctor came in contact with 800 people since March 12, and all of them have been to go for self-quarantine. Those who have symptoms of COVID-19, their samples will be taken and it will be sent for the test or confirmation test of COVID-19. So what you pointed out is absolutely true. It is very dangerous for the doctors and those who are in the front line to fight COVID-19. But also people have to realize that if they have any symptoms or if they have any travel history, if they have not disclosed yet, then they should disclose immediately, because they are not only by doing this, they are not only hiding the information with the doctors, but also they are at this point of time making a threat to the doctors as well as the people who are coming in contact with the doctors, which is very serious at this point of time. Back to you, Ankit.
Right. Stay on with me, Munish, because we'll just come back to you for an overall picture as well. Now, the death toll due to the coronavirus has climbed to 15 in India. Kashmir reported its first death after a 65-year-old patient passed away in Srinagar. The patient recently returned to Srinagar after attending an event with people from Indonesia and Malaysia. 11 people have tested positive for the coronavirus in Jammu and Kashmir so far. Another 85-year-old woman passed away in Ahmedabad, taking Gujarat's death toll to 2. Meanwhile, number of active coronavirus cases in India continue to surge and has now reached 572. 3 fresh cases have been reported from Goa. The infected patients have travel history to Spain, Australia and United States. 2 cases are also reported from Telangana on Wednesday. Maharashtra remains the worst affected state with 120 active coronavirus cases, followed by Kerala with 105 active cases. As Maharashtra is one of the worst hit in the coronavirus crisis, the pandemic, let me go across to my colleague Devesh, who is joining us live from Mumbai. Devesh, now the government has though taken some proactive measures, but what is it now being done to make sure that these numbers don't rise? Maharashtra is still at the top of the table in terms of active coronavirus cases.
Ankit, the lockdown being imposed, the national lockdown which is being imposed is followed strictly in many parts of Mumbai and across Maharashtra. Also, police officials are having a hard time arguing with people, asking them to remain indoors, if not necessary, not to venture out. But each and every person has some or the other excuse. Some are out to buy vegetables, some are out to buy groceries, and people are crowding up in places like grocery stores, vegetable markets. Police has been trying to explain each and every citizen, each and every person, that they should not crowd, they should not gather at a similar location, at a particular location, maintain social distancing. But people are not listening, though there were very few footfalls this morning in market areas, in areas where yesterday crowding was seen. But despite that, police is trying to impose the lockdown strictly now in areas like Mumbai, Thane and nearby areas. Also, municipal authorities have started sanitizing the whole areas using disinfectants which are being sprayed in multiple areas across Mumbai, Thane and areas which are beyond Thane like Kalyan, Dombivli, Ulhasnagar, where municipal authorities have deployed teams for sanitization of complete areas using the sodium hydroxide and also other disinfectants which are being used for spraying in lanes and other ghettos and other areas where there are huge number of slums. Their sanitization is being carried out so that there is no infection, that is infection in these particular areas. Also, police has been doing announcements on regular basis using their mobile vans, using the police vehicles, so that people don't venture out. Especially there was a fake message which was roaming, which was seen on social media platforms, which said that there was a particular time between 8 and 11 a.m. when people could step out for shopping. Also, India Today had done a fact-check story on this. But despite that, the footfalls have been rising in some of the areas. Ankit?
Thank you, Devesh, for joining us with all those details. Meanwhile, 2 new coronavirus cases have been confirmed in Andhra Pradesh, taking the total number of active cases in the state to 9. The first patient is a 22-year-old with a travel history to United States and is the resident of Andhra Pradesh, Krishna district. Now, while the second patient is a 52-year-old man who has a travel history to Delhi, making it completely local case. The man stayed along with 20 others at Nizamuddin Mosque in Delhi. He then took a train back to Andhra Pradesh, Guntur on March 18. One person has been cured of coronavirus in Andhra Pradesh so far.